So next is the subdivisions of the posterior triangle. The inferior belly of the omohyoid divides the entire posterior triangle into an upper occipital triangle and lower supraclavicular triangle. So if you see the features of this omohyoid, this inferior belly of omohyoid, it arises from the margins of suprascapular notch and from the adjacent transverse scapular ligament. After that, this fibers passes deep to the trapezius muscle. It passes upwards and forwards, and deep to the sternocleidomastoid, it is inserted into an intermediate tendon. So same like that, the superior belly of omohyoid, it arises from the greater corner of the hyoid bone. Then these fibers descends downwards and laterally to be inserted into this intermediate tendon. And this intermediate tendon is attached to the clavicle by a fascial sling, which is formed by the omohyoid fascia. So this inferior belly of omohyoid divides the posterior triangle into an upper large occipital triangle and a small supraclavicular triangle. So that's all about the subdivisions of the triangle. So next we can move on to the contents of the posterior triangle. So first we can see which are the nerves present in the posterior triangle. Trunks of brachial plexus, then nerve to subclavius, suprascapular nerve. So these two are the branches from the upper trunk. Dorsal scapular nerve, the branch from the C5 root. Long thoracic nerve, branch from the C5, C6, and C7. And spinal accessory nerve, which is the main content within the posterior triangle. Then 4 cutaneous nerves, already I have mentioned about that. So these are the nerves which is related with the posterior triangle. Next is the vessels, arteries and veins. Third part of subclavian artery and vein. Transverse cervical artery, which is a branch from the thyrocervical trunk, which is a branch of the subclavian artery. Then the suprascapular artery, that's also a branch from the thyrocervical trunk. Occipital artery, which is a branch from the external carotid artery. And the terminal part of external jugular vein. External jugular vein, which lies within the superficial fascia, which pierces the deep fascia about 2.5 centimeter above to the clavicle and empties into the subclavian vein. That's also contained within the posterior triangle, and some group of lymph nodes, supraclavicular lymph nodes and the occipital lymph nodes. So these are the contents within the entire posterior triangle. So now we are going to see the structures in details, and we are going to detailing in specifically like the structures present in the occipital triangle and the structures present in the supraclavicular triangle. So here you can see in this picture, the inferior belly of omohyoid have been taken out, and the remaining portions we can see here, inferior belly of omohyoid and the structures in the occipital triangle, structures in the supraclavicular triangle. So the main content is the spinal accessory nerve in the occipital triangle. So now we can go to the features of the spinal accessory nerve. It's the 11th cranial nerve, and it appears in the posterior triangle by passing deep to the sternocleidomastoid muscle. So it emerges about the midpoint of the posterior border of the sternocleidomastoid muscle, and immediately after entering into this posterior triangle, the spinal accessory nerve is hooked by the lesser occipital nerve. After that, it lies between the facial roof and the facial floor. So that means it lies between the investing layer of deep cervical fascia and the pre-vertebral fascia. So it lies between these two fascias, or facial roof and facial floor. After that, it rests within the levator scapular muscle. Then about 5 centimeter above to this clavicle, it disappears deep to the trapezius muscle. So once more, it enters into the posterior triangle at the midpoint of the posterior border of the sternocleidomastoid. Immediately after that, it's hooked by the lesser occipital nerve. It lies between the investing layer of deep cervical fascia and the prevertebral fascia. It rests on the levator scapular muscle. Then 5 centimeter above to the clavicle, it disappears deep to the trapezius muscle. So that's all with the spinal accessory nerve. It mainly gives motor branches to the sternocleidomastoid and the trapezius muscle. And this spinal accessory nerve, it divides the occipital triangle into above carefree triangle and below careful triangle, because the important structures are lying below to this spinal accessory nerve. So this triangle, this lower part of the occipital triangle is known as the careful triangle. And this spinal accessory nerve will be immediately surrounded by some group of superficial group of lymph nodes. So that's all with the spinal accessory nerve. So the next content, that is the third and fourth cervical nerves. Third and fourth cervical nerves. Here you can see these are the third and fourth cervical nerve. This arises from the cervical plexus. It runs downwards and laterally parallel to the spinal accessory nerve, and it disappears deep to the uh, trapezius muscle, and it mainly innervates to the trapezius and the levator scapulae muscle. So they mainly carries the proprioceptive sensation from these respective muscles. So it runs downwards and laterally backwards, uh, parallel to the spinal accessory nerve. So third and fourth cervical nerves. So next is the four cutaneous nerves. Four cutaneous nerves. So that already I have mentioned in the structures which lies within the roof. So four cutaneous nerves. So they are lesser occipital nerve, greater auricular nerve, anterior cutaneous nerve or transverse cervical nerve, and the supraclavicular nerve. So these are the four cutaneous nerve which lies within the roof. Before lying in the superficial fascia, it lies within the posterior triangle. So these four nerves are, the first one is the lesser occipital nerve. So this is lesser occipital nerve. It emerges from the midpoint of the posterior border of the sternocleidomastoid muscle. After that, immediately it hooks the spinal accessory nerve. Then it ascends upwards along the posterior margin of the sternocleidomastoid muscle, and it divides into branches. Anterior and posterior branch. Here you can see the anterior branch. The posterior branch. It supplies to the side of the head, posterior to the auricle, and the anterior branch. It supplies to the uh, cranial surface of the auricle, upper half of the cranial surface of the auricle. So that's regarding the lesser occipital nerve. Next is the greater auricular nerve. So that's also emerged from the midpoint of the posterior border of the sternocleidomastoid muscle. After that, it crosses obliquely to the muscle and ascends upwards. And at the level of the parotid gland, it divides into an anterior and posterior branch. Anterior branch, it supplies to the skin over the angle of mandible, and the posterior branch, it supplies to the cranial and the lateral surface of the auricle. So next one is the transverse cervical nerve or anterior cutaneous nerve. It emerges from the posterior border of the midpoint of the posterior border of sternocleidomastoid. Then it crosses the sternocleidomastoid muscle. After that, it divides into ascending and descending branch, which supplies to the skin of the side of the neck. And the last cutaneous nerve, that is the supraclavicular nerve. It arises as a trunk, and then it ascends upwards and pierces the deep fascia, that's the investing layer of the deep cervical fascia, and lies within the uh, superficial fascia. Then it divides into three cutaneous branches, and these three cutaneous branches are medial, intermediate, and lateral cutaneous branches of the supraclavicular nerve. First is the medial branch. Medial branch passes medially, and it mainly supplies to the sternoclavicular joint, and also it supplies to the skin extending up to the first rib. Next is the intermediate branch. It passes superficial to the middle of the clavicle, and sometimes, occasionally, it will pierces the bone. Yeah, so that's why clavicle is known as a dermal bone, because it's pierced by the intermediate branch of the supraclavicular nerve, and it mainly it supplies to the skin, which extending up to the sternal angle. Then the lateral branch, lateral cutaneous branch, it passes upwards and laterally to the it innervates the acromioclavicular joint, and also the skin over the upper and the posterior part of the shoulder. So that's all the features with this four cutaneous nerves. And this four cutaneous nerve is also a content within the posterior triangle before it appears in the superficial fascia. And this midpoint of the posterior border of the sternocleidomastoid muscle, and this point is known as the nerve point of the neck, because it's related with the numerous neural structures. So that's all with the cutaneous nerves. So spinal accessory nerve, then the cervical nerves, third and fourth cervical nerves, then four cutaneous nerves. So here you can see lesser occipital, greater auricular nerve, transverse cervical, and here the supraclavicular nerve. So these are the nerves